Good afternoon. Good afternoon and welcome to the White Coat Ceremony, endowed by the class of 1965. I'm Barry Collins, Associate Dean for Medical Alumni Affairs and Executive Director for the UVA Medical Alumni Association and Medical School Foundation. It's really an honor to be here today to welcome the class of 2024 and present them with their white coats today. I am definitely grateful for the patience from all the members of the class, especially as we navigated through the pandemic restrictions over the past year. I do have one housekeeping item to go over with everyone before we begin. I would just like to remind everybody that the University of Virginia does have a mask requirement for all indoor events, so I would appreciate if you could just keep your mask on and comply during the ceremony today. For all of those who are able to join us in person, I welcome you to Old Cabell Hall in the University of Virginia. Not far from where we are stands Pavilion 10, which is considered our first medical education building at the university. This was the home of Dr. Robley Dunglinson, who Thomas Jefferson recruited from London in 1824 to join the first faculty of the University of Virginia. Dunglinson was the first full professor of medicine in the United States and a leader in medical education. I would like to take this opportunity to thank the family and friends from the class of 2024 who have joined us from across the globe, both in this room and online, to celebrate this very special occasion. We are fortunate to have everybody here celebrate with us, and I understand for those that are watching online, sometimes the travel was a little bit too far, but we are glad that you could watch it live stream, and we will have it recorded afterwards as well. I would also like to thank our current medical students who are volunteering for us today, as well as the staff of the Medical Alumni Association, especially Wendy Baldwin, who put together all this program for us, and volunteers from the Health System Development Office who have helped us out with today's event. I would like to introduce our college deans. So if they could please stand as I recognize you. Dr. Meg Keeley, our interim senior associate dean for education, who also served as dean of Dunglinson College until this summer. Dr. Keeley. And her successor, Dr. Lori Archibald Pannone. Dr. John Densmore, Dean of Hunter College. Dr. Chris Peterson, who served as the college dean for Penn College. And Dr. Peterson will soon be enjoying a very well-deserved retirement. Congratulations. And Dr. Peterson's successor, Dr. Dana Reddick. And Dr. Sean Reed, Dean of Reed College. As many of you are aware, we have a regional campus in Northern Virginia, and I would like to welcome our colleagues, Dr. Craig Scheifetz, Regional Dean and Vice President of Corporate Health Services at Inova Fairfax, and Dr. Alicia Freedy, Assistant Dean for Curriculum. I would also like to recognize Dr. Kevan Van Landingham from the class of 1985 and the president of the UVA Medical Alumni Association Board of Directors. And Dr. Pat McManus, also from the class of 1985 and president of the UVA Medical School Foundation Board of Trustees. And I couldn't pass this opportunity up to introduce Dr. Charlie Henderson from the class of 1965. Dr. Henderson has many years of distinguished service to his alma mater. He is here today representing the medical school class of 1965. Through generous donations, his classes created an endowment which covered all the expenses for today's ceremony and the white coats that our students are going to receive today. Thank you, Dr. Henderson, and to your class of 1965. The University of Virginia Medical Alumni Association and Medical School Foundation have been here to serve the university for many years. The association was established in 1949, and the foundation was established in 1972, solely with the mission of benefiting the School of Medicine and the university. Our organization provides vital funding to the School of Medicine, supporting scholarships, research projects, and other School of Medicine priorities. In fiscal year 2022, we will provide $4.8 million to the School of Medicine, all through alumni support. I am proud that the tradition of giving begins with our students. Each year, the graduating class holds a fundraising project to give back to the institution. I hope the class of 2024 will match the generous spirit of the classes who preceded them and perhaps aim to even exceed their participation rate. Look for my message on your fourth year. For our students in the class of 2024, I do want to encourage you to be an active member of your Medical Alumni Association. Please get involved as students and stay involved as alumni. Now, a bit of history about the white coat. If we go back in time to the end of the 19th century, it was a period of tremendous progress in public health and medicine, when the benefits of sanitation and clean water were recognized. In the hospital settings, antiseptic revolutionized care. With the advent of germ theory, physicians aimed to be more scientific in their practice and their dress. Medical schools also adopted a more rigorous and standardized curriculum. The white coat embodied this new philosophy. While white is the color of hope and lab coat the symbol of the healer. Surgeons first began to wear the white coat, followed by hospital physicians and then general practitioners. By 1950, it had become the norm in the field of medicine. The white coat reminds physicians of their professional duties as prescribed by Hippocrates, to lead their lives and practice their art in respectability and honor. To honor this, the white coat ceremony is performed here at UVA for the incoming class at the beginning of each academic year. The white coat ceremony welcomes those embarking on their medical careers to the community of physicians by giving them the symbol of compassion and honor. The Medical Alumni Association is proud to be part of your medical journey. Now I would like to introduce Stephen Chirping, a member of the class of 2022 and president of the Mulholland Society, which is our student governing body for the School of Medicine. Welcome, Stephen.
Wow. Hello and welcome. Better late than never, huh? I've had the privilege to meet some of you, but for others, my name is Stephen Chirping. I'm a fourth-year student, aka the best year ever, and current president of the Mulholland Society. It is truly an honor and a privilege to be speaking with you all today, in person, after so much time. And I know it's been a while, but again, congratulations. You all, more than any UVA class previously, have truly earned this day. Not only did you matriculate to UVA in a pandemic, make friends in a COVID world, but you survived a mind-brain behavior anatomy practical. That's some cause for celebration. I am proud of you. Look around. Your family and friends are surely filled with such pride. Reflect for a moment on just how much you've already learned, how much you've already grown, and now let me tell you, it only gets better from here. Today you'll receive your shiny new white coat. In a few short months, you'll wear it in the hospital, taking care of patients. These are monumental steps in your young medical career. The hospital is a truly strange space, however, and so I feel it only fair to tell you that your experiences over the next year, some of which will be the most rewarding of your entire lives, will be anything but white, polished, and clean. Let me explain what I mean with an example. On my first overnight surgery call, busy doesn't begin to describe it. After multiple urgent dashes to the OR for bowel obstructions, 2 abscesses that need to be drained, and several traumas in the ED, it was still only 2 a.m. The next page we received was a strange one. Fecal disimpaction on the 8th floor. fecal disimpaction, hopefully never uttered on the old Cabell Auditorium again, is unfortunately what it sounds like. While I'll spare you the intimate details, we arrived to the patient room without a clear plan. It was only after the resident sheepishly handed me a bucket and told me, "I'm sorry. But just to warn you, we need you to catch." Medicine can be messy in other ways, though, ways that pull at your heart. While these patients don't exist in the pre-clerkship curriculum, many times over the next year, you will be faced with a situation without a clear answer. Whether it be a vague differential, extenuating social circumstances, or facing the very inevitable in our field. When I led my first goals of care meeting for an elderly woman with a complicated course and poor prognosis, I didn't start by describing her disease, the expected complications, even how we were treating her. Instead, I asked the patient's daughter to describe her mother to us, to help us as providers understand who we were taking care of. Her response still caught me by surprise. She loves to sit in her garden, listening to the bluebirds chirping. So simple, so non-medical. And yet it told us everything we needed to know about her goals going forward. The following day, we got the patient and her daughter to her home to listen to her birds in her garden where she lived out her final days. Now, I know that's a sad story, and we're here at White Coat. This is a time for celebration. Like I mentioned earlier, the hospital is a strange space, and a goals of care conversation in one room might be countered by celebration in the next. When it's a day full of fecal disimpaction, literally and metaphorically, how do you cope or even embrace the ambiguity? In a hospital full of grays, how do you keep your white coat, well, white? Other than a little bleach before the holidays so your mom doesn't yell at you again, the answer is remarkably simple. Be yourself. It should give you great confidence to know that all the intangibles you need to find success and fulfillment in this field are already within you. A focused and empathic gaze. A laugh for the patient who really just needs a laugh. A firm hand when there's not much more to hold on to. The $200,000 truth is, we learned how to take care of patients. Yeah. The $200,000 truth is, we learned how to take care of patients far before we learned where the spleen is located. We learn from our parents, our friends, and our experiences. Know that you can be the student who sees patients for who they are beneath the hospital gown simply by bringing yourself and not just your white coat forward. Seriously, you've got this. As you enter your clerkship year, you'll be asked to do many things you never have before. I challenge you with each of them. Bring your unique self, your flair, your idiosyncrasies that make you interesting. Even when you're uncomfortable or unsure, know that you're so much more than an elaborate Anki deck. You got here by being you, and by the looks of it, you're pretty freaking awesome. So, be resilient in the face of inevitable struggle. Stand up courageously against social injustice in the hospital and in the community. Be authentic and honest, especially when you don't know the answer. And when a young dad rips off his shirt to do skin to skin because he saw it in the baby books, don't be afraid to laugh, smile, and appreciate this field for all it is and can be. The truth is, your white coat, if you wear it right, will be anything but white. But the stains, the tinge of it, they are your story to tell. Be your authentic self for all that you are. Because you didn't get here by being ordinary. We need you to be your full self, perhaps now more than ever in this COVID world. Regardless of the path you take, these next 3 years will be truly special. You'll find a career, sure, but by bringing your whole self forward, you'll learn in a much more nuanced way what it means to be a healer. You'll take what you've known, and you'll wear it each day. Along the way, you'll find some lifelong friends, if you haven't already, to commiserate and to laugh with. And if you're really lucky and sitting in just the right spot, you might just find your best friend and future wife sitting at the table across from you. Altogether, when we acknowledge the ambiguity and embrace this profession for what it is, we will know just what a gift we've been given. This life, this experience, it's a true privilege. It's your story, your journey. And always remember and never forget, the joy is in the journey. Thank you all so much and congratulations.
Thank you, Stephen. I never thought that an appropriate stocking stuffer would be bleach, but this year it seems to be the right thing. At this time, I'd like to introduce Dr. Sue Pollard, who is our Senior Associate Dean for Faculty Affairs and Faculty Development, and an alumna from the class of 1982.
So good afternoon. As Barry said, I'm Susan Pollard, class of 82, a family physician and the Senior Associate Dean for Faculty Affairs and Faculty Development. And on behalf of the Dean's Office and our outgoing Dean, David Wilkes, I'd like to welcome you and thank everyone who's attending, either in person or virtually, to the class of 2024 White Coat Ceremony. I'd like to give, just as Stephen did, special recognition to the class of 2024 for completing this first year of their medical. There is a. Sorry, Barry. Sorry, I got stung by one of those the other day. To the class, I'd like to give credit to this class for completing the first year of their medical education journey, and especially for their resilience in doing so during such a challenging time as we all continue to navigate through this global pandemic, which unfortunately is not over. But today is a very special day for this class, and I think it's important to recognize all the family and friends and loved ones who've been part of your journey and have supported you supported you in getting here today. Today, as Stephen already mentioned, you revel in a job already well done, and yet you officially don your white coat and begin another part of your journey. To your patients and to your colleagues, these coats will mean that you're a source of knowledge, a helper, a healer, and someone to trust, even when you may not quite be ready to own that level of knowledge. But that is what you represent. So I suggest you feel the feelings that you're feeling right now, the feelings of joy and curiosity and angst and accomplishment, the feeling of joining something bigger than yourself. You're now part of our global community of professionals who've dedicated our lifetimes to searching and researching and to serving. And the history of those providers before you is woven into your white coats, and that adds to the responsibility that you bear now in your new role. In these roles, we hear tragedy and triumph. We see human suffering, and we see folks beating the odds. Together, we're present for first births, for successful treatments, for silent moments of incurable diagnoses, of denial, and of the passing of patients, whether they be adult or child, sometimes when it's far too soon, and always it feels unfair. But it's the most human thing we can do to be there with our patients and their families in these times, and certainly the most humbling. I hope as you move forward in your work at our great medical center and our great university, that your white coat will be a wearable reminder of your choice to pursue a life of service. You've answered a call to help those in need and to guide others to wellness. And you've joined a community of white coats. In not too much time, you'll discover more of what your new white coat stands for, what you stand for, not only for yourself, but to your family and friends and patients. So I'm honored to share this moment as you embark on that adventure and the identity of care providers and lifelong learners while continuing on your path of service. I do recall the very first time, I really do recall the very first time I was aware of the significance of the white coat that I had just received. It was in a day or two after receiving it when I happened to see a woman who was many months pregnant, and for some reason I was suddenly aware of what my role could be in her life and the life of her family. I realized that I could now be witness to a life-altering change for her and those around her as she moved from being an expectant mother to being a physical mother, caring for a new child who was entering the world. And while I was no better prepared to deliver a baby that day than the day before, I was suddenly aware of the awesome privilege that comes with that coat and comes with our profession. Wearing the white coat, I've heard stories that no one on this earth except me has, nor ever will hear. And I've learned over my many decades, Stephen's class of 22, I'm 82, Meg will speak is 92, we span 4 decades of providers. And the words Stephen spoke resonated so to me because it says that he learned the things I learned, that we share things with patients that no one else ever will. I've learned to see the very slight change in a facial expression or a tone of voice or even the level of eye contact that signals there's a story waiting to be told. And I've learned that to get to that story, I have to ask. I have to point out to the patient, to their family member, that something just changed, that I noticed something. And then I have to be able to ask humbly and respectfully and non-judgmentally whatever that change was about. Ask what they want me to know. And I promise you it never fails. It truly never fails that the story is there, waiting to be embraced and honored as significant and important, not just to the patient, but to me. And so I'm thinking about the care of one particular patient with high blood pressure. So when I was a resident and a young doctor, one person with high blood pressure seemed just like any other person with high blood pressure. I asked the same questions, I examined the same way, I ordered the same tests, and for all intents and purposes, I started them on essentially the same medicine or group of medicines. However, as the years passed and I learned to ask more than just one set of questions, as I took the risk of asking different, more personal questions, the stories started to change. And one day, to my utter amazement, a middle-aged woman that I was caring for who had particularly difficult to control high blood pressure revealed to me that she was the victim of years of intimate partner violence. She had learned to deal with that abuse by drinking alcohol to excess. And it was her alcoholism that made her blood pressure so difficult to control. I actually had known this patient for many years. She was a nurse in one of the clinics that I worked in when I was a student. And I remembered her in that role. She was professional, and she was competent, and she was tough, and honestly, she was scary to a third-year medical student. However, that day she was ashamed, and she was vulnerable, and she was frightened. And I was ashamed. I was ashamed that it had taken me so long to ask the right question. And I was frightened that I wouldn't know what to do for her. But actually, all she really needed to do was to be able to tell her story and for someone to be there to hear the truth and to listen without judgment. And so that new information that I learned that day changed the way we treated her high blood pressure. It allowed us to set goals that were realistic, goals for getting respite from her difficult home life, goals for finding alternatives to alcohol to reduce her stress, goals for getting support from her extended family. Her blood pressure was still hard to control at times, and her drinking problem contributed to her other medical problems. But we were able to focus on the real problems in her life, not just the problem that legitimately brought her to my office. We were able to think about keeping her well and allowing her to make the best possible life for herself. And despite the years of abuse and the risk to her own health, my patient did live with her husband until he died several years ago. Now, she's moved to another town to live with her beloved daughter's family. She's living the dream she hoped and waited for, and she's healthy and sober, and her blood pressure is no longer an issue. So we are at our best in medicine not when we prescribe the right medications or when we make the right diagnosis. You will be at your best when you can figure out how all the science and all the technical skill and all the knowledge can complement what you learn from the story of the patient in the room with you. And you can use all those skills to help this one person on this one day in their life and in yours. And so again, my congratulations and best wishes for continued success to the class of 2024 as you continue on your medical journey. Welcome.
Thank you, Dr. Pollard. Dr. Melina Kibbe has been appointed as the 17th Dean of the UVA School of Medicine. She begins her role on September 15th, but she did not want to miss the opportunity to greet you and has shared the following video welcome. So if we can cue up the video now, it would be great.
Good afternoon. My name is Melina Kibbe, and I am the next Dean of the School of Medicine, and I want to welcome all of you to Charlottesville and the University of Virginia School of Medicine. I really also want to thank our great partners at the Medical Alumni Association for supporting today's ceremony. And even though I could not be there in person, I am greatly honored to celebrate this important day with all of you virtually. So today we're celebrating the learners who have already embarked on a road to service. The donning of the white coat is an important ceremonial event for the class of 2024 as you take this important step to becoming a physician. Although the ceremony was delayed for a year because of the pandemic, today's bestowing of the white coat still has great personal and professional significance. I still remember the excitement, the anticipation, and incredible sense of unlimited possibilities that I felt waiting for my own white coat. I also vividly remember what it felt like to put the white coat on for the first time. That incredible sense of excitement for my future and the contributions and impact that I would hopefully make. Students of the class of 2024, you have already learned a critical skill in being a physician: how to adapt and be flexible in the face of change and uncertainty. When you began medical school, the world was in a different place from when you applied for admission. I applaud your perseverance. Even with all of the challenges, you've continued with your commitment to carry out this higher calling and serve others. This adaptability, the power to rapidly adjust to new facts and changing circumstances, is part of the life of being a physician. So you have already mastered a very important aspect of what it is to be a physician. You have begun a transformational journey. You already know it's inspiring and rigorous. One minute it's filled with enthusiasm and discovery, and the next being overwhelmed and exhausted. As you adapt, as you apply your knowledge and see results, you realize the profound difference you can make in the lives of others. You have already learned a lot about the scientific basis of medicine, how to take a clinical history, perform a mental and physical exam, order and interpret clinical tests, perform clinical procedures, and communicate with patients. As you continue to learn to identify, to apply preventative, curative, palliative clinical interventions, you will develop a prognosis about the future health of an individual based on their condition and the known interventions for it. You will become focused on learning, applying, questioning, double-checking, making sure, and doing it right. Remember, in the midst of your learning and applying this life-changing knowledge, the patient is at the center of all that you are doing. At the University of Virginia, first and foremost, we strive to be patient-centered. So think back to some of your own experiences as a patient. How long did you wait before you saw the doctor? And did your anxiety increase while you were waiting alone in the exam room? When the doctor walked in the room, did they look you in the eye and greet you? Or did they look at their notes and start talking? Did the doctor listen to what you were saying? Or did they seem to be more focused on a set of tests or a prescription to send you on your way? So as you advance through the curriculum and daily practice that will prepare you to become a physician, we want you to never lose sight of the humanity and the individuality of the people you are treating. We want you to enhance your capacity for compassion and genuine caring. The combination of knowledge and respect for those you are helping will ensure that you are a great healer, not merely a competent physician. Wearing the white coat is a constant reminder of this core relationship with the patient and your commitment to this life of service. I am so glad that you are here at the University of Virginia School of Medicine, and I can't wait to meet you all in person. You are making our school a better place. You will change how medicine is practiced. You will become the compassionate physician leaders of tomorrow. You will make us proud. You are the class of 2024. Congratulations.
We look forward to Dr. Kibbe's arrival next month. So now we'd like to move on to the ceremonial part and present you with your white coat. So I'd like to ask Dr. Meg Healy, our Senior Associate Dean for Education and an alumna from the class of '92, to come up and help us out.
Thank you, and good afternoon. As Barry said, I am Meg Healy. I am currently the Senior Associate Dean for Education. I'm also a pediatrician, and as you've heard several times, a very proud alumna of the University of Virginia School of Medicine. I have the honor of reading all of the important names sitting in front of us today, and we're going to be calling the students up in alphabetical order within their colleges. And as you may be aware, at the University of Virginia School of Medicine, we have divided our class into 4 colleges. And each of these is headed by a dean for student affairs who supports their students all the way through the journey through medical school. The college deans have the honor of putting on the white coat on their students at matriculation or a year later after matriculation, and they hood them at graduation. So it is a journey. 6 of the students in this year's class have immediate family members who are alumni or faculty in the School of Medicine family. These legacy students will be presented with their coats by their physician family members. The students in Dungleson College will receive their coats first. And as you heard, until last month, I had the honor of serving as the Dungleson College Dean for 11 years, including last year when we welcomed the class of 2024 to the UVA School of Medicine. I have been waiting a year to coat these students, and I am not going to miss my shot. So I have asked my colleague, Dr. Lori Archibald-Pannoni, who is the new dean of Dungleson College, to come to the podium to read their names. Dr. Archibald-Pannoni is a geriatrician and associate professor of internal medicine and completed her residency and fellowship training here at UVA. So students, here are the instructions. Ushers are going to stand in the aisles and signal your row when it is time to stand and proceed down to the stage. So you're going to be coming up here. You're going to come up on the stage and stand on this X that you'll see when you get here. And if you start to drift from the X, I'm going to pull you back on to the X. And then at this ceremony, our students are also signifying their pledge to joining our community of honor here at the University of Virginia. So after receiving your white coat, you're going to walk behind the podium and sign the honor scroll, which is sitting on this table, the white table here. And before you leave the stage, and you will come down the stairs here. Audience, I know it will be difficult but we're going to have you hold your applause until the very end of each college, or your students will have to join the first-year students who are in the next ceremony, and we all know that they do not want to repeat last year. So I appreciate your cooperation, and now we will have the students in Dungleson College.
Check to make sure if any students are not going to be here,
Uh-huh.
I'm going to come running up. I'm going to have it down here that they're not here.
Okay.
And we'll just skip over their name.
Okay. Okay.
Okay, welcome. Our first student, Julian Assan. Reminder, please hold your applause. Patrick Andrews. Natalie Blatz. Anna Brennan. Alexander Brundage. Magna Bunoska. Aniruddha Chandrabutla. Aniruddha will be presented with his white coat by his sister, Teja Shri Chandrabutla, Inova Chief Resident, Internal Medicine. Lucy Chu. Caroline Cotton. Nisha Dobby. Samarth Doshi. Dolan Edinburgh. Leela Ekambarapu. Catherine Franklin. Emily Franck. Russell Burnham Hawes III. Raina Wong. Hannah Sunhee Jacobsell. Amber James. Bradley Joseph. Shannon Kelly. Grant Lardieri. Gabrielle Levy. Sarah Marion. Braden Miller. Karina Navarro. Richard O. Elena Parcell. Swait Patel. Jose Perdomo Trejo. Andrew Schmidt. Zaher Sheikh. Callie Smith. Cameron Stadlin. Brian Sun. Allison Tim. Andy Vo. Elizabeth Watt. Simon White. Carly Witt. Benjamin Whitman. Janet Yan. Please give a hand for Dunglison College.
It's a rush every time. Next to present is Dr. John Densmore, Dean of Hunter College. He is a hematologist-oncologist and associate professor of internal medicine, and is also, importantly, our associate dean for admissions. Dr. Densmore received his PhD and MD degrees from UVA and completed his residency here as well, or as he says, he came and never left. Please welcome him to the stage.
Thank you.
Hunter College. Feyishiayo Oluwapelumi Adegboye. Jeffrey Bellinger. Riley Kalikia. Catherine Wayim Chun. Marina Dart. That definitely deserved extra applause. Elizabeth Driscoll. Elizabeth will be presented with her coat by her father, Robert Driscoll, MD, class of '87, resident 1990. Caroline Fisher. Mario Hernandez Carcamo. Logan Holly. Rachel Jacob. Evelyn Kahihu. Stephanie Katz. John Kittner. Martina Neckel. Venkatraman Kodendaraman. Christina Kirker. Quang Lei. David Leese. Kevin Livingstone. Rebecca Marchant. Emily Marrero. Brendan McNamara. Michaela Menschel. Eric Mubang. Sandeep Murthy. Stephen Neal. Bethany Neri. Fez Plastikwala. Jessica Chu. Tula Raghavan. Henna Raghavansi. Henna will be presented with her coat by her sister Jasmine Raghavansi, who graduated in 2021 and is currently a pediatric resident here at UVA. Brett Rangsagnola. Marissa Rayner. Sushma Reddy. Christian Renwick. Sarah Sebastian. Mira Srithran. Grant Sutherland. Cassie Telenko. Alexander Judson Wall. Amber Yee. Patricia Zhao. Ladies and gentlemen, Hunter College. Now, the students in Penn College will receive their coats, and presenting them will be Dr. Christine Peterson, Dean of Penn College. Dr. Peterson is a recently retired Associate Professor of Obstetrics and Gynecology, and after this ceremony, she will be a retired Dean of Student Affairs. Please welcome Dr. Peterson. The names of the Penn College students will be read by Dr. Dana Reddick, Associate Professor of Obstetrics and Gynecology. That's a qualification to be a dean of Penn College. And the new dean of Penn College, Dr. Reddick.
We'll start. Paul Armstrong. John Arnold. You can hug outside. Rachel Atkins. Hannah Batchelor. Jack Baruki. Jalen Broom. Manut Dhaliwal. Faven Gazain. Tony Gonk. Philip Groats. Jack Henshin. Jack is presenting his coat by his mother today, Colleen McNamara, resident from 1990, and current Edward W. and B. Knight Scripps Professor of Internal Medicine. Garrison Hughes. Elise Quo. Jack Lawton. Jessica Lynn. Aaliyah Mead. David Miller. Mackenzie Deck Myers. I'll work on it, okay?
Oh, that was not it, but it's okay. It's fine.
Anthony Wonkwo. Akua Nako Odum. Kranal Patel. Paulo Perez. Robin Pacavia. Jasmine Pringle. Erica Robinson. Christina Rofel. Anitha Satiety. Miski Sharif. She's being presented her coat by her sister, Aish Sharif, SMD 23. Shrikar Telavajala. Gada Tola. Glad to see you. Alper Turgut. Yazaman Vadat. Angela Wong. Margaret Wiltsey. You want me to say it? And a hand for the Penn College.
And now, Reed College and our dean, Dr. Sean Reed. He deserves that. Dr. Reed is Associate Professor of Family Medicine and completed his residency here at UVA. Please welcome him to the stage. Dr. Reed. Santos Acosta. Harris Bethel. Kimberly Bowen. Dawson Brown. Patrick Connolly. Ayush Doshi. Brenna Douthit. Chukwugozie EJ. Elizabeth Farah. Brian Florenzo. Elizabeth Fountain. Kylie Fultonier. Natalie Merriweather Goldfield. William Haskin. Margaret Hofstede. Taylor Horgan. Richard Huang. Joseph Waromo. Priyanka Kundor. Caroline Lebeg. Michael Lin. Kimberly Liu. Marie Mack. Shreya Mandava. Shashini Moodley. Maitri Patel. Jashraj Raghuvanshi. Nancy Shen. Caroline Shepard. Rudrajit Sinha. Angela Tang. Seth Turstig. Emily Venner. Mara Wigner. Abigail Williams. Congratulations to Reed College. So if the students would please remain seated, I'd like the rest of us to stand and recognize the University School of Medicine class of 2024. Next, I'm going to ask the faculty to join me on the stage, and I'm going to invite all the students to stand for the recitation of the covenant for the entering class and their teachers. The covenant is the first of 3 that you will recite during your medical education, and it serves to welcome you to the profession of medicine. The words are printed in your program. Stephen Chirping, the president of the Mulholland Society, will lead the students, and then I will recite with the faculty.
As I begin the study of medicine, I acknowledge and accept the responsibilities and privileges of an apprentice learner of ancient art and modern science. I will approach my studies with diligence and integrity, cultivating the competencies and attributes of an accomplished physician. I will respect all persons, including faculty and staff, student colleagues, and especially patients who will ever be my teachers. I will attend to the experiences, beliefs, and values of others and reflect on my own attitudes and assumptions. I affirm fidelity to my patients and will respect them, their choices, and their confidentiality. Mindful of my privileged access to their bodies, selves, and stories, I will seek to earn their trust and to care them with skill, understanding, compassion, and fairness. Medical school will not only cultivate my intellect, but also challenge my moral imagination. It will shape and test my critical judgment and show me my limitations as well as my competencies. It will entail risk. In learning, I will make mistakes, May I forgive and always remember and learn from them. Mindful of my own health and well-being, I will seek to balance professional and personal pursuits. I will value my family, friends, colleagues, and mentors, and the mutual trust, humor, and confidence our relationships sustain. My study of medicine will extend throughout my life, in school and beyond. I will hold myself to the highest professional standards. I will look to a collegial model of learning and working. Even now, I assume the physician's social responsibility to improve the health of humankind. We students here join our teachers to uphold our profession, honor its commitments, and advance its contributions.
As you embark on the study of medicine, I accept the privilege and responsibility of being your teacher. I will teach you the science and art of medicine and encourage you to be thoughtful, discerning, and compassionate in their practice. I will show you what is known and what is not known, what is certain and what is not. I will teach you to advance medical knowledge and skills, care for patients, and attend to the health of the public. Trust me to teach you as I trust you and your fellow students to teach me. You see reflected in me the character and social conscience of my profession. I will conduct myself with integrity and show you how I wrestle with issues of ethics and ambiguity. I will accord you respect, tolerance, and fair treatment. I am entrusted with teaching you to extend the same to your peers and patients. I encourage you to see patients as your tutors and to ground your relationships with them in advocacy, mutual vulnerability, and trust, and the utmost fidelity, for this is the heart of medicine. I will give you responsibilities and supervision appropriate to your knowledge and skills. I will not abandon you to your mistakes. I will encourage you always to put forth your best effort and will ask the same of myself. I ask you to recognize your teacher's limits and also your own, and to use your talents and energy to improve this institution and all that it offers. Together, we are stewards of an ancient and respected profession. You are this profession's future. Proudly, we welcome you into the study and life of medicine. You may be seated.
This brings us to the conclusion of the white coat ceremony for the class of 2024. I want to thank everyone again for joining again today, both online and in person. We will be taking a class portrait as well as photographs of each of the 4 colleges on the stairs of the rotunda, which directly face us across the lawn. To ensure that this is a swift and efficient process, we're first going to dismiss the students by college. And then once the students are dismissed, we're going to invite all of our guests to join us for refreshments by the rotunda. After these formal photos are taken, there will be plenty of opportunities for you to take your own photos with your students. So if I could ask Dunlison College, Drs. Keeley and Dr. Archibald Pannone, to please escort them to the rotunda. And as a reminder, folks, all the photos that are taken today, they're going to be available for free download, and the link's going to be emailed to all the students and family members next week, so stay tuned for those. And then you can, of course, also check our Facebook page for video and featured posts on the ceremony.